Hello, this is Group 6 and my name is Angela. Our presentation today is to compare Rosemary Parse, Human Becoming Theory and Comfort Theory by Catherine Kolkaba. Group 6 members are Ansana Christine, Angela, Joseph Lindsay, Rumbao Daisy, and Shane Ying. Introduction. In this discussion, we are going to talk about the name of the theorists to include their brief backgrounds, the name of the theory and its major concepts, that is philosophical underpinning, the fundamental idea about the theorist, that is the assumption, one advantage and one disadvantage of a theory, the key differences between the theorists, and the values and usefulness of these theories in nursing. In our conclusion, we're going to discuss about our personal opinion on how useful each theory is and why we found Rosemary Parse Human Becoming Theory more useful or helpful in nursing. What is nursing theory, I ask? Nursing theory is an organized framework of concepts and purposes designed to guide the practice of nursing. The first nursing theories appeared in the late 1800s when a strong emphasis was placed on nursing education. Nursing theories were therefore developed to explain and describe nursing care practices and to provide a foundation for clinical decision-making in nursing. I'm now going to discuss the brief background of Dr. Rosemary Parse. Dr. Rosemary Parse is a graduate of Duquesne University in Pittsburgh, where she also received a master's and a doctorate. She was a member of the faculty of University of Pittsburgh, dean of the nursing school of Duquesne University. She was also a professor and a coordinator of the Center of the Nursing Research at Anti-College of the City University of New York, that is between 1983 and 1993, and a professor and New York chair at Loyola University, Chicago, between 1993 and 2006. Since January of 2007, she has been a consultant and a visiting scholar at the New York University College of Nursing. Dr. Parse is also a founder and a current editor of the Nursing Science Quarterly and a president of Discovery International. She is also a founder of the Institute of Human Becoming. Dr. Parse is also a fellow in the American Academy of Nursing, where she initiated and is the immediate past chair of the Nursing Theory Guide Practice Expert Panel. She has been given 2 Lifetime Achievement Awards. Throughout her career, Dr. Parse has made outstanding contribution to the profession of nursing through her progressive leadership in nursing theory, research, education, and practice. She has published 9 books and more than 100 articles and editorials about matters pertaining to nursing.
Hi, I'm Ying. Thank you, Angela. I will continue to talk about the background of nursing theorist. Catherine Kolkaba. She was born in 1944 in Cleveland, Ohio. In 1965, graduated with Diploma of Nursing from St. Lucas Hospital, School of Nursing. In 1987, graduated with RN MSN from Francis Payne Barton, School of Nursing, Case Western Reserve University. In 1987, began teaching at the University of Akron College of Nursing. In 1991 to 2001, development of comfort theory. In 1991, published the article, A Taxonomy Structure for the Concept of Nursing. Began development of cell grid diagramming types of comfort and the concept of in which comfort occurs. In 1991, published the article, Analysis of Concept of Comfort. Analysis of the word comfort from its London roots to the meaning of everyday language. Article also include how the word has been used. In 1994, published the article, A Theory of Holistic Comfort in Nursing, began develop a diagramming of aspect of comfort. Article also includes 6 defining facts that examine why comfort is a significant middle-range theory. In 1995, published the article, The Art of Comfort Care, that describes benefits of including comfort care into practice. It includes a taxonomy from a student nurse who applied comfort care to practice. In 1997, graduated with a PhD nursing from Case Western Reserve University. In 1997, developed a website called Comfort Line. The name comes from method of determining levels of comfort in children, in which a vertical 10 centimeter line is drawing and the patient reach their level of current comfort between the statements of I feel as comfortable as possible and am as uncomfortable as possible. And 2003, published her book, Comfort Theory and Practice, a vision for holistic healthy care and research. In 2007, retired from full-time teaching, continues to teaching part-time while developing and researching comfort theory. Thank you.
Thank you, Ying, for that. My name is Daisy. Now I'm going to discuss the major concepts of the human becoming theory by Parse. There are 3 principles constitute the human becoming theory flowing from these themes. Number 1, meaning. Man's reality is given meaning through life experiences. Number 2, rhythmicity. Man and environment co-create. That includes imaging, valuing, languaging in rhythmical patterns. Number 3, transcendence refers to reaching out and beyond the limits that a person set. While the comfort theory, the major concepts are healthcare needs, comfort needs arising from stressful healthcare situations that cannot be met by recipients' traditional support systems. Comfort intervention are nursing action and referrals designed to address specific comfort needs of recipients. Intervening variables are interacting forces that influence recipients' perceptors of the total comfort. Health-seeking behaviors compose a broad category outcomes related to the pursuit of health. Institutional integrity, corporations, communities, schools, hospitals, regions, states, and countries. Best practices, the use of healthcare interventions based on evidence to produce the best possible patient and family outcomes. Best policies, institutional or regional policies ranging from protocols for procedures and medical conditions to access and delivery of healthcare. The conceptual framework shows the different concepts linked together in nursing care. And about the fundamental ideas about the theory of human becoming, there are 4 assumptions. Human becoming is configuring rhythmical human universe pattern. Human becoming is co-transcending illimitably with emerging possible. Human becoming is human universe co-creating a seamless symphony. Human becoming is structuring meaning, freely choosing with situation. Fundamental ideas about the theory of comfort. Number 1, human beings have holistic response to complex stimuli. Number 2, comfort is a desirable holistic outcome that is germane to the discipline of nursing. 3, comfort is a basic human needs that person strive to meet or have met. It is an active endeavor. Number 4, enhanced comfort is strengthen patients to engage in health-seeking behaviors of their choice. Number 5, patients who are empowered to actively engage in health-seeking behaviors are satisfied with their health care. The last one, institutional integrity, is based on a value system oriented to the recipients of care. Thank you.
Hi, my name is Christine. My topics are advantages and disadvantages of Rosemary Parse' Human Becoming Theory and Catherine Kalkaba's Theory of Comfort. The advantages of Human Becoming Theory are useful in education, provides research methodologies, provides framework to guide inquiry of other theories. The advantages of Theory of Comfort are the theoretical structure of Kalkaba's Comfort of Theory has real potential to direct the work and thinking of all healthcare providers within one institution. The comfort theory can be applied to all patients of all ages, cultures, backgrounds, and communities. It is applicable to patients in the hospital, clinic, and home. The disadvantages of Human Becoming Theory are research considered to be in a closed circle, no control group, standardized questions, not accessible to the novice nurse, not applicable to acute and emergent care. The disadvantages of Theory of Comforts are it addresses comfort and how it can improve patient outcomes, but fails to expand adequately on how these comfort measures can be used outside of the hospital setting. The author gave her definition of comfort. However, this definition is constantly evolving and expanding to include a wider array of health behaviors. Now I'm going to discuss the key differences between the two theories. Human Becoming Theory includes totality paradigm. Man is a combination of biological, psychological, sociological, and spiritual factors. Simultaneity paradigm. Man is a unitary being, continuous, mutual interaction with the environment, and originally man living health theory. Catherine Kalkaba's theory, holistic comfort, is defined as the immediate experience of being strengthened through having the needs for self-relief, ease, and transcendence met in four contexts of experience: physical, psychospiritual, social, and environmental. The theoretical structure of Kalkaba's comfort theory has real potential to direct the work and thinking of all healthcare providers within one institution.
Thanks, Christy. Now you have the idea about differences between these theories. Hi, my name is Lindsay Joseph. Now I am going to explain value and usefulness of theory to nursing. According to Mrs. Parse's theory, the theory guides nurses in their practice to focus on a quality of life, as it is described and lived. Also, it presents an alternative to both the conventional biomedical approach and the biopsychosocial spiritual approach of most other theories of nursing. The model differentiates nursing from other disciplines. It provides guidance of care and useful administration, and is useful in education too. To conclude, the Parse theory provides a transformative approach to all levels of nursing. It differs from the traditional nursing process, particularly in that it does not fix problems. The model gives the nurses the ability to see the patient viewpoint. This allows the nurse to be with the patient and guide him or her towards the health goals. The nurse-patient relationship co-creates changing health patterns. Along with exploring, nurse will clarify how they want us to work with them. According to Kalkaba theory, it also supports psychosocial spiritual approach. This approach is based on comfort theory. The difference between both these theories is the individual approach made in nursing. As per Kolkaba theory, before and after the nursing intervention, the patient will be questioned based on a comfort questionnaire. This gives a nurse how the nursing intervention performed on a scale of 0 to 10, 10 being the highest comfort scale. Comparing these theories, we would prefer to go with the Parse theory, because in this theory, the nurse explores various possible approaches to be with the patient. This gives the nurse what to perform to achieve her goals. To prove this, we would like to give an example. According to Parse theory, if a client is admitted with the diagnosis of cancer, the nurse will be trying to explore her by asking her various questions, and the nurse will intervene according to the patient needs. But in Kolkaba theory, the patient will be asked questions before and after the intervention through a comfort questionnaire. This could be a long process and time-taking. Instead, once you explore the patient needs, interventions can be made by taking quick decisions. Kolkaba theory has to wait for all the responses to the questionnaire before and after the intervention. I hope you learned something new. Thank you for listening to our presentation.